Antons syndrome, blind but unaware. Intro. A mind that insists it can see. Imagine being completely blind. And not knowing it. Not pretending. Not denying it. But genuinely believing you can see. You describe rooms, faces, and objects with confidence. Even though your brain is no longer receiving visual information. This is not a psychological trick. It's not stubbornness. It's a rare neurological condition called Antons syndrome. And it reveals something deeply unsettling about how the brain creates reality. What is Antons syndrome? Antons syndrome is a condition where a person is cortically blind. Meaning their eyes may function, but the visual cortex of the brain does not. Despite this, the person insists they can see. They may walk into walls, trip over objects, miss obvious obstacles. Yet when questioned, they often give detailed descriptions of what they believe is in front of them. This lack of awareness is not intentional. The brain simply doesn't register the loss. Cortical blindness explained. To understand Antons syndrome, you need to understand how vision works. Seeing doesn't happen in the eyes. It happens in the occipital lobes, at the back of the brain. If these areas are damaged, often by stroke, head injury, oxygen deprivation, infection or disease, the brain can no longer process visual input. The eyes may still send signals, but the brain can't interpret them. The result is cortical blindness. Antons syndrome occurs when cortical blindness is paired with complete unawareness of that blindness. Anosognosia, the brain's denial system. Antons syndrome is part of a broader phenomenon called anosognosia. Anosognosia is when someone is unaware of their own neurological condition. This can happen with paralysis, speech loss, memory disorders, blindness. In Antons syndrome, the brain areas responsible for self-awareness and error detection are also impaired. So when vision fails, the brain doesn't raise an alarm. Instead, it fills in the gaps. Confabulation, making up reality. One of the most fascinating and disturbing features of Antons syndrome is confabulation. When asked what they see, patients don't usually say nothing. They describe furniture, people, landscapes, colors. Their descriptions may sound convincing, but they are entirely invented by the brain. This isn't lying. The brain is guessing, using memory, context, and expectation to create a version of reality that feels real to the person. The mind would rather invent a world than accept that it can't see one. Real cases of Antons syndrome. Doctors have documented patients who attempted to read blank pages, reached for objects that weren't there, walked confidently into doors. When challenged, some became frustrated or confused. Others remained calm and insistent. To them, nothing was wrong. This makes Antons syndrome especially dangerous, as patients may refuse help or put themselves at risk. How rare is it? Antons syndrome is extremely rare. Most cases occur after bilateral strokes affecting both occipital lobes. It's often temporary, but in some cases, it can persist long-term. Because of its rarity, many clinicians may never encounter it directly, making diagnosis challenging. Can it be treated? There is no direct cure for Antons syndrome. Treatment focuses on managing the underlying cause, like stroke recovery, rehabilitation, ensuring patient safety. In some cases, awareness gradually improves. In others, it does not. Recovery depends on the extent of brain damage and the brain's ability to reorganize itself. What Antons syndrome teaches us. Antons syndrome reveals a profound truth. We don't experience reality directly. The brain constructs it. When information is missing, the brain doesn't always admit uncertainty. It fills the silence with stories, vision, awareness, and certainty, are far more fragile than we like to believe. Conclusion: the brain that won't admit it's wrong. Antons syndrome isn't just about blindness. It's about belief. A reminder that consciousness is not a perfect mirror of the world, but a narrative the brain tells itself. And sometimes, that story is completely wrong.